many people attended this last year, but we're gonna do it the same way. So we're basically gonna watch the 3 horses trot. We'll watch them trot down and back, and then trot on a circle each way. And then I just want, I think rather last year we kind of printed it and had you write it down, but I think honestly, I think the exercise will work fine. You just have to decide in your mind which horse you think, if you think they are lame, and then if you do, which leg it is. So that's the key. And we're really just going to do that first, and then after that, I'm going to come back and talk to you a little bit about how to see the lameness. And then we're going to watch them all go again and see if anybody wants to change their opinion. So really, it's just kind of a hands-on exercise, and what we try to do each time is pick one that's really quite obviously lame, one that is a little bit lame, and then one that is not so lame. And so it's a little bit for everybody. And I realize there's usually a really wide range of people's understanding, and it's not necessarily honestly always about like being a good horse person or not a good horse person. It's just like for vets too. Some people, it's really easy for them to see lameness. I think it's your eyes move really fast, it's really quick, and you can see it. And other people, you can be the best horse person in the world and have a ton of even, veterinary knowledge and experience, and it's a hard thing for people to do is to see it. So again, if you have trouble seeing it, don't feel bad. It's just, I think some people's brain, it's easier for them to see movement, things like that. So this is going to be, we'll just say horse number 1 to make it simple. So it'll be horse number 1, 2, and 3. So we're going to just walk the horse down and back, and then jog the horse down and back.
Are you saying that there is one horse that is not lame?
I'm saying there's one horse that's not very lame, one that's kind of medium, and one that's quite lame.
Okay.
So. And this one's a pretty young horse, so she might not lunge perfectly, just to warn everyone ahead of time. I don't know if you want to whip her. I think she did it yesterday without. Is that what Julian said? donors. They live together like non-stop, so. Last year, they were all supposed to be lame last year, and he was actually one of them, and he ended up being sound, and it was sort of awkward. And so this year, he actually is quite a bit lamer than he normally is. So, so basically, just in case anybody's worried about what they were thinking, so there's one really lame horse, and then there's two kind of medium lame horses, but there isn't a very sound horse in the group, so that's okay. Sometimes that happens. So this is a quick review for everybody before we watch them again. So really, the easiest way to see it is the principle they call it down on sound. That is a much easier way to learn it. I mean, really, if you think about it, it's the opposite, right? It's their head comes up on the lame leg because you basically take your weight off something that hurts, so you put your lame foot down and you kind of go, ooh, and then you shift over to the other one. The problem is for most people, and definitely myself included, is if just your eyes don't go fast enough, by the time you watch the horse's head come up, and then you look down to see which leg it is, you lost a beat. And so if you do it that way, you almost always get the wrong one and have to like almost, you know, flip it back. And so the much easier way for your brain and your eye to see it is called down on sound. And so essentially, as the horse is trotting, its head goes down on the sound, the good leg, and then it comes up on the lame leg, goes down on the sound leg, comes up on the lame leg. And so that's really the easiest principle in seeing it. We're not doing hind ones today because again, it's just they're even harder to see, and it's really hard, I think, in a 20 or 30 minute spiel to teach people hind end lameness. But if the same principle applies if you're looking at the horse from behind and you watch their hips. Basically, the hip that's kind of lame tends to go like this big kind of up and down motion, and the sort of not lame one has a much smaller motion. But again, for today, we're going to mostly focus on, like I said, this down on sound as far as telling which leg is lame in the front end, and all three of these horses are definitely front end lame. So I think we'll start with the sort of the most obvious one. The other question to ask yourself is we grade lamenesses on their severity, and so I think everybody here could say, oh yeah, that's obviously a bad lameness, but when we're trying to communicate like to other vets or to each other is to say how lame is it. We tend to grade them on a scale of 1 to 5, and obviously 0 is no lameness. It's kind of easy. 5 is extreme lameness, like they're just holding their foot up in the air, they won't even put any weight on it. 4 is essentially lame at the walk, so as they're walking, you can see them doing it even as they're walking. A grade 3 is essentially they're lame in a trot, but only in a straight line, or sorry, in a straight line. So whether you circle them, they're going straight, you can always see it. Grade 2 is you can see it, but only on a circle, so you can't see it on a straight line, but you can see it when they're on a circle. And then a grade 1 is really like intermittent. So essentially, like you might see a couple stabs, then it looks fine. Might see a couple stabs, then it looks fine again. So that's kind of how we grade it. One of the problems you can imagine is you can be lame on a straight line, but really, really mildly, like just barely. And so that for us is still a grade 3 as opposed to a horse that's maybe really lame on a circle. And so people get sometimes I think a little bit frustrated by that. It's like, okay, well this horse is really lame when I put her on a circle, and this other one is only just a teeny bit, but it's on a straight. Even though one will get like a more severe lameness score, but that's just, you know, as they say, I didn't make the scale, but that's how it works. But you'll hear vets sometimes talk about like a mild grade 2 or like a really severe grade 3, and that's kind of what we're doing. So basically what we're going to do next again is we're going to watch them go again, and after they've gone, then we're going to kind of talk about it, and we'll ask you what you think. Certainly, like I said, hopefully this one everybody can see that the horse is lame, but we'll talk about which leg and which grade it is. So yeah, so go ahead and we'll walk down and back again. Jog down and back one time since I know she is pretty sore and we won't do this as well, so. So first off, I guess the question is, do you guys feel like you can see the lameness at the walk or just at the trot? At the walk. Yeah, no, I mean you definitely can. It's certainly, as lamenesses go at the walk, it's not the most severe. I mean, some of them are like, you know, they barely kind of put their toe down and then go to the next. So, you know, she's, you know, not as bad as some of them are at the walk, but I agree. You can definitely see that she, you know, will put her head down a little bit more on one stride and lift it up a little bit on the other stride. So for lameness, we would categorize, you know, as a grade 4 lameness because it is present at the walk. So like I said, as walk lamenesses go, it probably might be more of a mild grade 4 because it's not that, you know, like, oh my gosh, how are they going to take the next step kind of lameness? And then how about as far as which leg it is? What do you guys think?
Left front.
Left front, very good. So everybody can see that the horse's head clearly went down every time the right leg went down. And that one, I think, you know, hopefully it sounds like was pretty easy for people to see. That's the easiest way, honestly, to start. Like if you're somebody who hasn't seen them before, horses like that are the way to start. Like trying to see ones that are really subtle. It's very easy to confuse yourself. People get frustrated. They feel like, well, they're not quite sure they're seeing it. So pick, if you can, again, if you're somebody that's getting started with it, try to pick horses like that to learn on and to watch. Especially if there's somebody there who already knows what leg it is, because you'll get the most out of it like that is doing just what we're doing, where you watch the horse go, force yourself to pick a leg, and then do it. For anybody that really wants to learn, the single best place to do it is endurance rides, if anybody's interested in them, because they just watch horse after horse trot down and back, trot down and back. And if you go and volunteer like as a vet secretary, basically the horse trots down and back, and then the vet says whether they think it's lame and which leg. And so it's like a perfect way to learn because it forces you stand there, you watch the horse trot down and back, and then in your mind you at least have to say, I think it's lame or I don't, and which leg do I think it is, and then you basically get the answer key after that because the vet says lame right front, and you know whether you were right or wrong, and they do that like, you know, hundreds of times in one day. So not that it necessarily means that it's your sport, but as far as just a good place to go and see a whole bunch at one time, and if you feel like you're getting really good at it, that's a really good place to go. So, all right, so we're gonna go with horse number 2 now, and we'll walk her down and back. first question, does everybody agree they feel like they can see a lameness with her? And if you don't, that's okay too. Sometimes people will say, you know, they're not quite convinced. So how many people feel like yes, lame?
Yes.
Well, most people feel like yes, lame. She's definitely much milder than the other horse, right? Very, very different. So first question, is the horse lame at the walk, you guys think? Yeah, I would say no. I mean, there's definitely, she took some steps. So, and this is a huge problem for veterinarians, is it comes down to consistency. So a lot of lame horses that might only be lame on a circle, you know, will especially that are foot sore, which is what she is, you know, will hit like a rock or a hard spot and will take a bad step at the walk. And so there's no question that they took a lame step at the walk. What the reality is we try to decide how consistent is it, and is it really like, you know, every stride, taking a lame step at the walk. And so, like, I would say for the purposes at least of today, I'm just trying to keep it pretty simple. I would say she's not particularly lame at the walk. Again, I think if somebody, you know, really took me to task and videoed it, you could probably say she's a little bit uneven. But I think, at least especially compared to the other horse, if the horse really doesn't have a real big lameness at the walk. So then the next question is, do you guys feel like the horse is... So the next question is, do you guys feel like the horse is lame at the trot in a straight line? See a lot of people shaking their head, and you know, I would tend to agree. Again, I don't know if you saw when she decelerated at the end, she took some lame steps. So I suspect that if you put her under what we call special circumstances, where you trotted her downhill, you probably would be more apt to see it in a straight line. But really, I think if you just, again, kind of for the purposes of keeping it simple, just trotted her sort of straight and we're being pretty fair and even, I would say she doesn't have a very obvious lameness in a straight line. Again, not totally even, but pretty reasonable. And then how about on a circle? She shows lameness on a circle, yeah. Everybody's nodding their head. So what grade of lameness would she be then? What's that? Yeah, so she's a grade 2. So basically, you know, we wouldn't say we consistently see it at a walk or on a straight line, but definitely as soon as you put her on a circle. So then the next important question is, before we say which leg it is, why does it sometimes more obvious on a circle than on a straight line? Like what is that phenomenon? Why does that happen? What's that?
Pressure on the joints?
Yeah, pressure on the joints, or it's mostly a weight-bearing phenomenon, right? Like you're basically forcing them to carry more weight on one leg than the other. And that rule holds up in general pretty well, which is that the leg that's on the inside when you're circling tends to be the lame leg. So if we have like, you know, vet students or people here and you're, you know, kind of quizzing them, I always tell people if you're going to guess the inside leg, because that's usually going to be the lame one. There are some exceptions though. I mean, it makes sense, right? If you injure the inside of the leg versus the outside of the leg, when you have it on the inside or the outside, it changes which part of the leg is weight bearing. So sometimes you can get burned on that. So if you always guess that, you'll be wrong sometimes. But probably 80% of the time even, or you know, even maybe a little bit more, if you guess the inside leg, you're going to end up being right, because that tends to be the one that's bearing more weight. So in her case, what leg was she lame on? So I heard some rights, some lefts. So she was left front. You guys want to watch her trot one more time in a circle?
Yeah.
Yeah, okay, why don't we do it just one more time on a circle just so you guys can see. And with her, I'm also going to call it out just in case there's anybody who's having any trouble seeing it. Yeah.
What is the cause of lameness on the bay bear? You never said.
Yeah, you know, actually, I don't know. That one was given to me just for the day, and it wasn't one that I think she has like a foot problem, but I actually don't know the cause with her.
How about this one?
This one is she's foot sore, like and just like to the bottom. She's actually the owner of the horse is up there, so she came to watch. So I'm gonna call it out. So basically, it's down, 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 down. Down, 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 down. So you guys, anybody that's having trouble seeing it, can you kind of see what we're talking about? Is basically what and that's actually an easy way to cheat if you want, is to have like somebody call out when the head is going down, and then somebody look at which leg it is. If you're having trouble marrying them, that's the easiest way to kind of, again, start to learn. But again, if you watch her head as it goes down and that right foot is hitting the ground, that's the sort of down on sound principle. And like I said, she nicely follows the rule because it's the leg that's on the inside, and so that's easy and that's great. But again, they don't always do that. But she's a pretty good example of like a pretty classic grade 2 horse that basically is definitely lame on a circle, but not as obviously lame on a straight line. The head goes down on the sound leg, so it's basically you have to kind of flip it. So if the right one is the down leg, then it's the left that's lame. So.
We've had your exercise today.
Yes, ma'am.
So this is Gus. Like I said, this is on and off lame, though it has been not so lame for the last year or two, but chose today to be more lame, so that's okay. You guys can see the shave mark on his neck. He actually just about a week ago did a blood donation for a little baby foal who lived and did really well, so he's a good guy. I think we talked about it. Gus is definitely lame today, no question. So first thing is, do you guys think you can see it at a walk? Yeah, I agree, though. Again, I would say he's definitely, not a particularly severe walk lameness. So I think there probably are people that would call him a grade 4, but I think there's probably some people that call him a grade 3 too. I mean, he really, doesn't have a big head bob at the walk. So I think probably again in the world of keeping it simple. Oh, we might watch him one more time though. So in the world of just kind of keeping it simple, he's probably really more of a grade, not a grade 4. But again, you could argue that he does take some not so great steps at the walk. How about in a trot in a straight line? Yeah, definitely. So he trots along every single stride. His head goes down. And then on a circle, do you guys feel like you can see it in one direction or both directions? Both directions. And so then again, before we say what leg it is, the most important question is it the same leg in both directions or a different leg? Because we see that problem a lot actually, that they'll be lame in both front feet. And so in a circle to the left, they're lame on the left front, and in a circle to the right, they're lame on the right front. So you have to be careful. Do you think it's the same leg in both directions or a different leg in both directions? Same, yeah, very good. So let's, I guess we want to trot him down and back once, and I'll call it out again for anybody that's not sure. So down, 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 down. Do it on the way back. Down, 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 down. Everybody feel like they're pretty sure which leg it is now, or does anybody want to see it one more time? One more time. Will you really let his head when you go? Down, 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 which is the down leg, the sound leg? Left, very good. So the lame leg then would be the right. And then we'll just show them to you one last time on a circle. And again, you have to decide 100% if you think it's the same leg on both sides or not. Not so much that he doesn't follow the rule, because he's even lamer in the other direction, but he doesn't switch, so he's a true lameness, so to speak. He's lame on the right front going either direction. Go back to the right, and he is typical in the sense that it's worse with the leg on the inside, at least most of the time. Down, 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 down. So that's a pretty good kind of spectrum of horses. So we have a horse who's the dark bay, who's really lame and basically lame at the walk, really lame at the trot. Gus, who's lame at the trot in a straight line, but probably not too bad at the walk. And then the little one who's lame only at the trot in a circle. So it's a pretty good spectrum. I try, like I said, normally to have one that's not very lame to kind of not trick everybody, but give you kind of a perspective. And again, Gus ended up being a little lamer today than he was supposed to be. But that's typical. The only other thing we don't have is we have 3 really nice, quiet horses. And it's important to remember if you're looking at really hot horses, like young horses or Arabs or things like that, they tend to like pick their head way up and lift their tail up. It gets a lot harder to see when they're like throwing their head and doing different things. These guys made it really easy for you today. They're all that kind of really quiet, like even paces. And like I think last year, if anybody was here, we had a little pony who was a firecracker, and even though he was really lame, he was actually a little harder to see because he's like just jumping around and doing it. The same happens on the hind limb sometimes too. Is that it's much easier to see when their tail's quiet and down. Anybody that has Arabs, again, they carry their tail to one side and hide one of the hip bones. All of a sudden, everything goes out the door, and it gets a lot harder. So, and then young horses are about the worst because they don't keep an even cadence, and so they're stopping, they're going, they're speeding up, slowing down, and that makes it incredibly difficult. My last comment I always tell people is just as far as making it easier to see it. Remember, like a really loose rein and a little slower is much easier to see it, and it's. The opposite is true. I hate to say this, but we've seen it all. But if you're trying to hide a lameness, the best thing to do is go really fast and pull on the line as you're going, and all of a sudden you're like, well, I think I might see it, but I'm not sure. And that's same thing. You can sometimes turn their head one side or the other, and so it's like when we see somebody trotting a horse really fast, pulling on the lead rope to one side, it's like I bet that horse is lame and they know it, as opposed to a horse that's just trotting really even, loose and free with nothing pulling on its head. Those are much easier to see. So, anyways, that's a lifetime of lameness in 15 minutes.